Hello, everyone, and welcome to this Lupus Europe Youth Group webinar on sex. So our speaker today is Dr. Cristiana Siero Santos, who is a rheumatologist and clinical researcher in the Division of Musculoskeletal and Dermatological Sciences at the University of Manchester and National Institute of Health and Care Research, Manchester Biomedical Research Centre. But I will ask Cristiana to say a bit more about herself in a bit. First of all, I would like to say a bit about why we are talking about sex. So, why should we talk about sex? Why is it important? Well, sexual health is part of overall well being. And when it's neglected, it can lead to depression, anxiety, or strained relationships. Despite this, sexual health is rarely discussed openly in medical settings, especially along with young people. Many lupus patients experience issues related to intimacy, desire, body image, and fatigue, but often lack safe spaces to talk about them. We hope that this webinar, which was developed in collaboration between Dr. Santos and the Lupus Europe Youth Group, with support from our coordinator, Lena Koskina, can be that safe space and provide accurate information that helps young people understand how lupus and medication can affect sexuality and how potential issues can be overcome. Sexual health is still very taboo in many cultures. This kind of webinar can hopefully help normalize conversations around sex and lupus, reducing shame and helping young people feel less alone in their experiences. This conversation between our youth group members and Christiana here today can hopefully act as a model of how you can talk about these issues safely and confidently with your own care team. Now, I have to mention that we are streaming live on Facebook today, so we will also be taking questions from Facebook users. You can ask questions along the way, and if we haven't gotten to your question yet, we will get to it at the end, I'll make sure. So, Christiana, maybe I will leave the floor to you for a bit.
Thank you so much, Jeanette, and hello everyone, and welcome. I'm Cristiana Siero Santos, like Jeanette has just introduced me, and I'm a rheumatologist based in Spain, but currently in the UK. And it's a real honor to be with you today. I think having this much needed conversation on sexual health and lupus. So, sexual well-being is a topic I think that for professionals and for patients alike, this often feels a bit uncomfortable talking about. But the truth is, it matters deeply. Intimacy, desire, confidence, connection, these are elements to our quality of life. And for many people living with lupus, these areas sometimes are affected by symptoms like pain, fatigue, dryness, and even medication side effects. So we hope today to create a safe, respectful, and open space where we can talk honestly without stigma, without shame about the challenges that people with lupus may face when it comes to their sexual health. And I'll try my best to answer as many questions as you have. So please feel free to ask questions in the chat throughout the session. And remember, no question is too small or too personal. If it matters to you, it matters. So let's get started and let's talk about sex.
Thank you. And with that introduction, I would ask our very talented youth group members who are here today to ask questions. So I know, Leah, you have the very first question.
So, a couple of years ago, I had a sexual problem related to my lupus, and it was very hard to find out because I couldn't talk it out to my doctors. Many individuals in the lupus community find it challenging to discuss sexual health with their doctors, often feeling embarrassed or uncertain about how to approach the topic. How can we feel more comfortable discussing sex with our physicians, and how can we overcome this difficulty?
First of all, thank you so much, Leah, for sharing that. You have a nice slide that shows that research often shows that nearly 40% of people feel uncomfortable discussing their sexual health with their doctors. So I would say that this is something that we as you as patients and as a physician should really uh, maybe try to adjust and try to develop some strategies so we can overcome this problem. For patients, I think the best way perhaps is to prepare in advance what you want to ask to your physician. Writing it down perhaps might help. and even starting the conversation like, I have a personal question I want to ask you. I have been hesitant to ask you, but I think it's important. Preparing it in advance, what it needs, what it helps you with is that if you bring it early, sometimes because it's a topic that makes you nervous, we'll have more time as physicians to properly address it in the visit. Because sometimes these topics, you tend to leave the last question, the most important question, to the end of the visit, and we are already thinking about the next visit, and we are not addressing it properly. So I would say that preparing it in advance, writing it down, and bringing it up as soon as you enter the visit, that would be a good step. And also using simple, direct language. I don't think you have to be clinical. I don't think you have to be technical. Saying it's something that you're struggling with and you want to know if it may be related to your disease, to your treatment, and how can we solve this together. I think if it matters to you, it's worth being discussed. And then on the other side, for physicians, it's really our responsibility to create a space and to normalize these types of conversation. So we should also not wait for you to bring it up. Of course, there are situations where your physician will not bring it up or the patient will not bring it up, but I think we should help each other in that way. So for us, it's not to wait for the patients to bring it up. Try to use simple, non-judgmental questions like, how is your energy level? Some patients may associate or may have problems with their intimacy. Has this happened to you? And recognizing what you have just done, Leah, which is sharing your experience. So that's something I think that we should thank our patients and be glad that they brought it up. So that's it.
Thank you, Cristiana. Yeah, you're definitely right. It's very, very brave to bring it up, Leah. So thank you very much for that question. And I know that the Makaya has the next question that she would like to ask on behalf of the group.
Absolutely. So one thing I struggled with greatly when I got into a relationship was discussing sex with my partner and how my medications affected me. So essentially, sometimes my sex drive would be high, sometimes it would be low. And I know my partner often felt rejected because he didn't know at what point I felt what. And I just didn't know how to embrace those conversations with him, to discuss his needs, to discuss my needs. And I also didn't know who to go to be able to start that dialogue with my partner, or how, an effective way to start that dialogue with my partner. So the question we have is, many people in the lupus community struggle with the impact of the disease on their relationships and intimacy. So what advice would you give to someone with lupus on how to communicate openly and effectively with their partner, and the impact of the condition on their sexual health needs and boundaries? Thank you.
So thank you once more for sharing your experience. So communication, I think, is an act of intimacy in itself, and being open about how lupus may affect you physically, emotionally, and sexually can even strengthen your connection. So I'll tell you a bit of a prejudice of my own. When we were prepping for this webinar, and I had a nice talk with Jeanette and the team. And we as physicians have this idea that it could only affect negatively your relationship or your sexuality, and that's probably not the case. If you're open with your partner, it can even strengthen your connection. So that's something I think that if you're communicating and your partner is fully aware, I think they can really help you, because if they are your partner, they care about you, they will want to know what is going on and what ways they can help you. And also I think for us, sharing, and I know that there are several, Lupus Europe has a lot, and also national lupus associations, including Lupus UK, Lupus Foundation of America, have nice patient-friendly guides, even the Living with Lupus brochures, and also there are infographics or short videos on fatigue, joint pain, and intimacy. And also, I would say that involving you should consider involving your partner in your visits, and because I think it's important for them to know what is going on, and for them to have a relationship with your physician as well. So those would be some of the my advices on how to communicate more openly with your partner.
Yeah, thank you very much, Cristiana. And thank you, Makaya, for also being very open for this question. And I can say I always bring my husband to every visit, even though it's been many, many years since I was diagnosed. And it helps because I know that he knows about my lupus. So that is a big help. So the next person who is going to ask question is Lynette.
Thank you. So, women lupus patients often discuss being more prone to vaginal infections. This is a common topic among us, and many of us are experiencing it. How can individuals with lupus manage or prevent an increased risk of vaginal infections, such as yeast infections or bacterial vaginosis, especially after sexual intercourse? And what practical advice can doctors provide to address this?
Thank you, Lynette, for the question. So yes, indeed, research suggests that up to 50% of lupus patients has recurrent infections. So, and this could be because of their disease activity and because of the immunosuppressive therapy that often can disrupt, in the case of women, the normal vaginal microbiota. So we would say that to prevent infections, using normally fragrance-free soaps for intimate areas, avoiding any supplements like scented or even bubble baths could be a way to irritate your vaginal mucosa. Urination, even for women that don't have lupus, after intercourse can help flush out some of the bacteria and reduce urinary or vaginal infections. Also taking into account during menstruation that changing sanitary products as regularly and often considering fragrance-free options is a nice way. You can discuss with your physician also using probiotics, whether they are oral or vaginal, that can help build up a healthier vagina flora that often can help and can prevent experiencing infections. And in the case of patients who are treated with steroids, you know that maintaining a good blood sugar can also be a nice way to prevent the developing yeast infections, because high glucose levels can promote yeast growth. Hydration is another good point. A good anti-inflammatory diet also can help boost up your immune system. And I've heard from patients, some of them keep a symptom diary, which are useful to us as well, to physicians. Some patients have even associated changes in the medication of also with flares and with the changes in their sexual activity. So that could also be helpful to us to maybe tailor a prevention plan. And I know you have a question on dryness, but if we are talking also on dryness, there are some hyaluronic acid moisturizers or even lubricants that can be helpful. And if we reduce dryness, as a result, we'll have a lower infection risk by protecting the vaginal lining. And again, I know I've said a lot about communication, but not being afraid to bring this subject up with your doctor is extremely important as well.
Thank you.
Thank you very much, Cristiana. Yeah, and I'm one of those who often suffer from vaginal infections. So I try to follow all that advice, and I can tell you it does work. And you know that it works because when you forget to do it, we have another infection. So thank you so much for that. So the next question is going to be posed by Makaya.
Thank you. So we had some input from our male counterparts of the group, and unfortunately they couldn't be here today, but we just wanted to make sure that we had sort of feedback on everybody's experiences, not just the women's. So one of the questions one of our male colleagues asked was, many individuals in the lupus community are experiencing severe manifestations, such as lupus nephritis. Is there any connection between lupus disease activity, like lupus nephritis, and its impact on sexual health, including the libido?
Yes, absolutely. So, up to 60% of people with lupus have reported a reduced sexual satisfaction, and lupus nephritis and a higher disease activity are associated with decreased libido, vaginal dryness for women, erectile dysfunction for men, pain during sex, and also difficulty in achieving orgasm. And there are several factors that go into play. One of them, physical symptoms, of course, fatigue, joint pain, poor sleep. Medication is also a factor to take into account. The use of steroids, immunosuppressants, antidepressants, and psychological factors and like anxiety, depression, and even body image concerns, which might be associated with your disease. So the weight changes associated with the steroid use, the rashes, the hair loss. So again, managing the disease activity is a key step in improving your sexual health and improving your libido. Also communication with your healthcare provider and as with the patients and with their partners as well, and multidisciplinary care. I think even we know that we are very limited in our national health system, but it would be great to be collaborating with sexologists and with other specialists that could help us uh, address these subjects more properly.
Definitely, that would be the ideal situation, I think, for everyone. And I think you mentioned something very important here. We shouldn't underestimate how much the mental thing is actually how much stress can mean to your libido and to sex in general. So it's not only the symptoms of the disease, but also the mental burden of having a chronic disease that's added on top. So for the next question, I know you already said a bit about dryness, but maybe Leah can ask you if there's anything else you would like to add.
Yeah, so the Living with Lupus 2020 survey showed that the 56.9% are experiencing dryness of the skin and the 54.5% dryness on the mouth. So, do you have any advices for women dealing with dryness or people dealing with Sjogren's syndrome?
Thank you. Yeah, I've mentioned a tiny bit. So, of course, moisturizers could help, vaginal moisturizers for women to maintain hydration and also a bit of tissue elasticity. Lubrication could be a nice way. So, there are water-based and silicone-based lubricants that could often reduce friction and enhance comfort during sex. There are also low dose vaginal estrogen, which we, of course, in lupus patients and in APS patients, you should ask your physician first because it could be contraindicated in some patients. And also, I think engaging in sexual stimulation. So, if there is, I'm going to if there is enough blood flow, so through masturbation or it can also preserve vaginal and in the case of men as well, tissue health, and that could perhaps help with the dryness.
Yeah, thank you. And I think, ladies, this is a very good occasion to say to your husbands or partners, I need to be properly lubricated, so you need to really make an effort. Right?
Sure, this is a collaborative effort, of
It
course.
is, yeah. So, moving on to Lynette for the next question.
Thank you. So, can lupus medications like corticoids, immunosuppressants, or antidepressants cause sexual dysfunction?
We need the next
And
slide, please.
which
Yes, thank you. Go
and
ahead.
which so I'll start again. So, can lupus medications like corticoids, immunosuppressants, or antidepressants cause sexual dysfunction? And which drugs are most likely? Why? And what advice would you have for male patients? So, this is from a male perspective once again.
Yeah, so yes, and this is a topic I think that deserves much much attention in our routine care. So there are several medications that we use to manage lupus symptoms and comorbidities that can negatively affect our sexual health. They could manifest in different ways. So one would be a decreased libido, like we say, vaginal dryness, erectile dysfunction, delayed orgasm, or even a reduced arousal. So these changes are due to hormone disruption most of the times, nervous side effects or vascular impacts. So steroids like prednisone, the way that they work is they suppress the gonadotropins, and also in men they would suppress testosterone, so they would lead to a low libido and to mood changes and fatigue. Immunosuppressants such as methotrexate also are associated with a low libido, and they often the mechanism is that they also suppress hormones, and in some cases they can lead to gonadal toxicity as well. Antidepressants such as fluoxetine or sertraline that are also very common in patients in our clinical practice, they also can lead to erectile dysfunction and also reduced arousal. And the way that they work is serotonin uh, is a molecule that is often associated with sexual arousal. So by reducing serotonin, they can influence negatively. Antihypertensives that we also use for patients in general, but in case we have a patient with lupus nephritis, they can also act negatively by reducing blood flow and producing hormonal shifts. And opioids that we use for pain, such as tramadol or morphine, they can also, what they do is they suppress your hypothalamic pituitary axis, and as so they can suppress your libido and even lead to an orgasmia, which is a difficulty in achieving an orgasm. So the way that what we can do is communication. Again, I think it's the operative word in this webinar, but really talking to your doctor, and even for us, considering adjusting medication, sometimes lowering the dose is enough. Sometimes switching to an alternative drug can help. Sometimes exploring timing, taking in a different time of the day can also reduce side effects. Addressing related factors, so fatigue, pain, anxiety are very common, and they do play a role, and we need to address them head on. And again, the multidisciplinary care. So communication and multidisciplinary care, I think, are one of the more, for me, I think one of the summaries of the webinar. But yes, I think those will be the ways to address this.
Those are always important in every part of life, not least here. So I think, and I think you also highlighted that it's important for us all to know that the medicine can actually play a role here for the libido, and not to feel
Absolutely.
bad about it, and try
Oh,
to find solutions. So don't go
absolutely.
around with a reduced libido and think it's all in my head, and I should just never mention it. Mention it, because there might be something you can actually do about it.
Absolutely. I think that's the message. You should talk to your physician, and like we said, disease activity, medication, and other like factors play a role, a very important role here. So by discussing it and finding what the pattern is, we can address it head on and improve the quality of life of our patients, which I think that's what we all want.
Exactly. Yeah. Thank you. So, Makaya, you have another question.
Of course, I think it's one of our favourite topics, fatigue. So, according to the Living with Lupus 2020 survey, fatigue was the most common symptom among patients, with a percentage of up to 85.3%. Is there a direct link between lupus disease activity and symptoms like fatigue and decreased sexual libido? If so, what are the underlying mechanisms with a focus on the impact of fatigue?
Yeah, so absolutely. It's just to say that it's one of the favorite topics for us. It's one of the most scary subjects because we don't really, we sometimes struggle a lot on how to address this, how to help our patients with it. But of course, fatigue is not just about being tired. Really, it's a persistent, overwhelming lack of physical and mental energy, and of course, it will affect your sexual health. So it will lead to a reduced libido, because again, fatigue, what will lead is will drain emotional and physical energy, and will make you less eager to start or to initiate intimacy. So mental fatigue, brain fog, low motivation, they play a role here. Also, impaired arousal, like we say, because again, with arousal, it's a complex interplay of neurological, hormonal, and vascular processes, which are disrupted by chronic inflammation that is often associated with lupus, stress, and poor sleep. Also, if there is an interplay with chronic pain and fibromyalgia, this also will take an enormous, what will lead is to a vicious cycle where pain leads to fatigue, fatigue leads to emotional withdrawal, and your intimacy will suffer. And then if we're talking about the underlying mechanisms, inflammatory cytokines such as IL-1, IL-6, and TNF-alpha, which are often elevated in active lupus, they will play a role, and they will lead to low energy, to social withdrawal. And these are cytokines that are both implicated in fatigue and in reduced sexual function. And if you're not sleeping, of course, you're going to have a reduced libido. So all of this is connected, and it will lead to a decreased sexual libido.
Yeah, everything is connected, right? And yet another reason why we should look for new medications to solve fatigue, or maybe even non-pharmacological solutions, so we can reduce fatigue in everyone.
Absolutely.
Yeah, thank you so much. So Lynette, you have another question.
Thank you. So this is quite a popular one on contraceptives. Um, in the lupus community, as women, we do not have all the contraceptive options available to us. And what would you say is the safest contraceptive options for patients with lupus, particularly considering the risks associated with hormonal contraceptives like estrogen and the potential for blood clots or antiphospholipid syndrome, APS? Sorry, I hate such a tongue tie.
No, thank you. This is a great question, and it is nice to be discussing contraception. Actually, there were a lot of guidelines that were not aligned. So I think until 2024, there was especially in the US, there is some things the different between the eligibility criteria for contraceptive use and also the 2020 American College of Rheumatology guidelines regarding the use of contraceptives, which now have aligned. But there are several options. So I think if we're discussing long-acting reversible contraception, IUDs, so intrauterine devices, and subdermal progestin implants should be the first line recommendations for all lupus patients, regardless of their APL or their antiphospholipid autoantibodies or their disease activity. These are very effectively, so they have less than 1% annual pregnancy risk. They are estrogen free, and they do not increase infection risk. So for patients that are on immunosuppressives, this could be a nice alternative. Also for patients that are, because there was some studies that show that patients on mycophenolate could have problems, but implants and IUDs are a nice alternative for patients that are on immunosuppressives. There are progestin only contraceptives, so this would be contraceptives with no estrogen. So there are progestin only pills, and there is a prescription with drospirenone, which for patients with kidney disease, we have to be a bit careful because it could lead to hyperkalemia. But the contraceptives that we should definitely avoid are estrogen-containing contraceptives, so they are contraindicated in patients with positive and antiphospholipid autoantibodies, or who have a moderate to high lupus disease activity, because, like you say, they can increase thrombotic risk and also flare risk. And there are also barrier methods like condoms that we know that are less effective, but they carry no thrombosis risk, and they protect against sexual transmitted diseases, which we should take them into account. And if we are discussing emergency contraception, so this is a safe and effective option for all lupus patients. Of course, you have to take it within 72 hours of an unprotected intercourse.
Thank you so much, Cristiana. That is very elaborate answer. Yeah, important to know that we need to choose our contraceptives according to our disease activity and which comorbidities we have as well. I think that's very important to keep in mind. So the next question is from Leah.
Yeah, so based on the Living with Lupus 2020 survey, 76.9% of lupus patients experience pain and/or swelling in their joints. What advice would you give to someone with lupus who wants to engage in sexual activity, and how can they manage symptoms like pain or joint stiffness to make the experience more comfortable and enjoyable?
Okay, so I think timing matters. So planning it, I think it's a nice way. Although I don't want to ruin anyone's spontaneity. I think being spontaneous is very important when we're talking about sex. But planning your intimacy when your energy levels are high and your pain level is lower, I think it's always a nice strategy. Pain management before or after. So I think taking pain medication, if it's the case, if you feel any discomfort after having sex, it can reduce discomfort. Choosing your more comfortable position. So of course, putting less strain or less pressure in your painful joints is something to take into account. Even the use of supportive pillows, which I've while I was searching for the webinar, I found some interesting items. But there's something about supportive tools that we can use, even adjustable beds or chairs that could also help minimizing the pressure in certain areas. Communication again. I keep repeating myself, but I do feel if you have honest conversations with your partner, if you talk about it physically and emotionally, and if you say I'm comfortable with this, I'm not comfortable with that, I think every partner will, if they love you, I think they will be willing to adjust, and they will understand the challenges. And managing dryness again, I think if you, again, dryness can be associated with pain. And also taking breaks if you need them, because I think intimacy, then again, it doesn't follow a strict script. You should be focused on connection, on pleasure, rather than a performance. So I think pacing yourself is really important. Addressing your emotional health, massages could be a nice way, and warm baths, but I think if I had to say one, I would say communication for sure.
Definitely, yes. Speaking from personal experience, I can say sometimes just seizing the moment is the right thing to do. If you feel now, yeah, I have a bit of energy, I'm not in as much pain, that might be the right time. And hopefully your partner will be on board with that. And also reminding yourself that there's a lot more to sexuality than just sexual intercourse. I mean, intimacy brings so much to a relationship, right? And some often when you focus just on being intimate with each other, things can develop by themselves, and then suddenly you will be in a situation where now is the right time. But as you say, communication, it's very important. And I think it's even more important for us in our situation. So, Makaya, you also have a question.
Absolutely. I think we touched on this briefly in the last question, but if someone is sore after having sex, what recovery tips can help alleviate body soreness the next day?
So we have already mentioned a few, but I would say that stretching, yoga, so exercise helps. Hydration also helps muscle to recover. Massages can also be a nice way, and prioritizing your rest and your sleep. I think that's a nice way as well.
We joked a bit about before this webinar that we should plan our sexual relationships according to when we have appointments with our physiotherapists. But having
What?
physiotherapy afterwards can definitely be beneficial, I think.
Yeah, sure, of course, yes.
So, all kidding aside, we now have, I think, the last prepared question anyway, by Leah.
Yeah, so last but not least, how would you as a doctor respond if a patient suggested collaborating with a sexologist to address the sexual health challenges faced by a lupus patient? Do you see value in such partnership, and how might it benefit patient care?
I definitely see value in it. I think I would very much like to collaborate with a sexologist. I think they would be very valuable to me. Sexual health is vital. I think it's a very neglected aspect of care in chronic diseases like lupus. So by working along with a sexologist, I think we can not only address physical symptoms and disease-related symptoms, but I think other factors, of course, emotional and also relational factors which might be impacting your intimacy. So any type of multidisciplinary approach, I think, promotes holistic care, and it can help ultimately to improve the quality of life of our patients. So I would definitely be open to that. The problem is, like I said before, we don't often have these professionals in our everyday hospitals or in your clinics. So it's difficult. And sometimes if you want to say to the patient that to seek the help, so they have to seek help there by themselves. So it's a bit tricky, but I do see its value, and I would love to have a multidisciplinary team that we could use to address these types of subjects head on.
Yeah, and I can give a very good example actually from the Danish Lupus group, where some years ago we had a theme day for young people with lupus and their partners, and we invited a lupus nurse and a sexologist who actually knew each other, so that was a coincidence. But and she gave a presentation on what is sex, what is a good sexual life, and all these things we just discussed here, and then we opened up a conversation with the entire group, which was very beneficial for everyone, I think, and gave a lot of input. So it can be up to the patient organizations to involve sexologists. If it's not possible in the healthcare system, then we can at least do that, and helping patients that way, I think is a good solution.
I think even if we just start the conversation, Jeanette, and people feel like we are listening to them and we are wholeheartedly trying to help and trying to make some changes for them to improve their quality of life. I think that's already a useful way. But of course, I think if we could collaborate in with the sexologist, that would of course make it much better. But I think if we are taking small steps, I think starting up the conversation and addressing these subjects, and it's already, I think, a big step for so many physicians, I would like to say, because I do feel patients, of course, they should feel free and feel good enough so they can ask these questions. But I think it's on us as well. We should ask them how are they feeling, and if they are experiencing any difficulty, so that they will feel valued and listened, and validate their experiences in a way.
Definitely. And at the same time, we as patients have to remember that physicians are also people. They're also persons. So not everyone will actually feel comfortable speaking about sex and these things. But then it's important to find someone who is willing and happy to talk about it. And often you can find that in the clinic, either with a nurse or someone else, or they can maybe refer to someone else, a colleague who will listen to the patient and be more open to have these conversations. And I think that's equally on the physician side as on the patient side. So if the physician seems like he or she doesn't want to talk, then you might bring up, so is there anyone else in the clinic who might be able to talk with me about this? Because I actually think this is very important. And it
Sure.
is extremely important. As I mentioned at the beginning, sexual well-being is so important for our well-being, the general well-being. So please don't be afraid to bring up these topics. So now you've heard a lot of questions and a lot of good answers. So now we are opening up if anyone out there has any questions, any burning thoughts, or just comments that you would like to bring up. Do we have anything from Facebook, Zoe?
We do actually. We have one question from Facebook from Anne-Marie, which is how could menopause and lupus influence your libido while using various immunosuppressive meds?
Of course, it does influence because menopause, again, it's your libido will already be affected if you don't have lupus, because again, vaginal dryness and also your hormonal level, so that will influence your libido. If you add on top of that a chronic illness and the use of medications such as antidepressants or immunosuppressants, that will play a role into it. So of course, menopause, we know it's a physiological um, period that we'll know that will happen, but if we control your disease activity and if you maybe make slight adjustments to the immunosuppressants, if you can, because there are cases that we are not able to, with that way, perhaps we can help our patients to not feel like their sexual well-being is so affected or affected negatively by menopause and by other factors. But of course, that's a very nice question.
Yeah. So, we just got a question in this group. Is there any non-pharmacological integrative that that could help with libido or to have more energy?
Mhm. So I think
It's,
we covered a lot of symptoms, right? So non-pharmacological, I think, to help with your libido. So I think I said a couple on timing it and or of using. I think if you have perhaps like if I think if you have a nicer experience during intercourse, you probably be more you we probably get more into it and want to do it a next time, right? So
mm,
I think if you work on uh like exercise, it's an obvious answer, of course. If you're doing yoga, if you're stretching, if you're having an active life, I think that's a nice way because you that will help with your fatigue, and I think that will also help a bit with your libido. But I think if you make it more pleasurable in some way, so if you're struggling with joint pain, maybe the adjustments that we discussed, maybe using medication to relieve your pain, also using certain like the adjustables, even the pillows that we discussed. I think those perhaps could help, and that way I think you, instead of fearing uh, sexual intimacy, I think you'll have a much more and a nicer experience. And I think for all women and for people in general, if you have a nice time, I think you'll want to do it again. So I think that's an obvious response.
yeah, making it a positive experience.
Of
Yeah.
course.
And also, I think all the normal non-pharmacological treatments for lupus also comes in play here, right? Like smoking cessation. So if you're smoking, stop smoking, live healthily. Just try to live with a healthy lifestyle. And I know that's impossible, but as much as possible. And as you say, also exercise. It's really important for your own well-being as well. And we all know that if you feel good about yourself, you will want to interact more with your partner. So that's really good advice. So, Lena is asking, is it safe to engage in sexual activity during a lupus flare? A good question.
Yes, it is safe to have sex during a flare. However, I think that probably you will not be as comfortable, or probably you could have, like we said, lupus flare is usually associated with a high inflammatory cytokines and a higher activity level. So yeah, the answer is it is safe, but you could have the word will not be consequences, but I think it could play a negative role afterwards. So really, I think sex in itself, it could also help a way, because it has been proven that it can help with the inflammation and also with cytokine levels. But I think the answer here is just to listen to your own body. I don't think I'm in a place where I can say, if you're having a flare you shouldn't have sex. I don't think that's the case. So there's really no risk. But of course, there will be people that perhaps could have like pain, joint pain afterwards, and that perhaps there will be people that will will feel better afterwards. So the answer is there is no risk, but I think that you should really answer to you to listen to your own body and see what is best for you.
Yeah, and I think the operative thing here is also that if you know you're having a flare and you know that you might feel better afterwards, or you really need to be close to your partner, as I said before, start by being intimate. And maybe that's not the day where you have really rigorous sex, so try to plan a bit and use as much comfort as you can, and knowing that afterwards you will probably need to pay a price of some sort, but
Sure.
definitely it's often worth it. So it's safe to do. Don't worry. So, from Zoe, a question to both you and me, Christiana. Do you
Okay.
think there are any myths or misconceptions about sex and lupus that should be debunked, either from the physician side or from the patient side?
Hmm.
So, I'll
That's
leave.
it's an interesting question. Myths or misconceptions about sex. No misconception comes to mind. I think to have a misconception, I think we have to talk enough about it, and we are not talking enough about this
That's a
subject.
good point.
So I think that the from the physician side, I don't think there is no, I don't think there is any misconception. I just think we avoid the subject altogether, and
Yeah.
we should not. Yes, I don't know what's your opinion, Jeanette, on it.
Yeah, one thing is actually that often patients think that the physician doesn't want to talk about it, and that's why we don't start talking about it. That can
Yeah,
be one misconception.
yeah,
But
yeah, that's true. That's true. I think people, again, like you said, people sometimes surprise you because
mm,
sometimes they seem open and they are not, and sometimes they seem close and they are not. So I think it should be a shared responsibility. We
yeah,
should ask, but then you like you said, I think we should accept our limitations. So if we don't feel comfortable discussing it, the patient has a right to ask, so maybe we should refer the patient to someone who might be more comfortable.
mm.
So yes, I think, yeah, probably, yeah.
Another thing that I mentioned the theme day we had for young people and their spouses or partners. We actually at one point divided the two groups and then asked. It just happened to be all the women were the ones with lupus and all the men were the partners. could have been different, but that was the case. So we asked all the women what questions they would like to ask the men, and the men what questions they would like to ask the women, and also what they thought of each other. So what do the women think that the men think about them? And one very interesting thing that came up, which is a misconception for many people with lupus, is that the women were afraid that the men were disappointed about their sexual life. So they thought the men wanted more sex than they were getting, and they felt guilty because they couldn't give it as much because of their disease. And in reality, what the men was concerned about was, I'm just concerned that she's feeling comfortable. I don't care about sex as long as we can still be intimate with each other and we can still love each other, and I can support her in the best possible way. And I think that's a very big misconception that exists.
Sure. So I think yes, you're right. So and also I think the question that I think it was Lena that asked it, right? So about lupus, about sex, and if it can induce flares, if it can worsen a flare, and also I think probably thinking that lupus patients probably are they lose interest in sex, so that's really not the case, or that automatically it makes it more difficult to have sex because of the pain, which is also not true at all, or that some medications can also make it the sex unsafe, or maybe are incompatible with intimacy. So I think if we discuss this appropriately, if we ask these questions, I think some of these myths. But I think ultimately, it's if we talk and if we ask, no matter how I think no matter how silly the question is, because if it's important to you, I think it's worth discussing. And
Yeah.
at the end of the day, I think, well, I can only speak for me, but I think if I'm helping anyone with simple question, I don't think we are not in a position to judge, and I think we just want to help. So it's not about feeling silly, not at all. I think you should ask, and we should answer. And if you are not prepared to do it, accept your own limitations as well, and like you say, Jeanette, just refer to a colleague that perhaps is more knowledgeable or more open, and also being open to consult with a sexologist as well.
Yeah.
So it's okay to know that you don't have all the answers. I certainly don't. So
Yeah. I don't either. Exactly. So I actually have a question for you because one of the things we didn't discuss at this session because it's mostly about sex is, so what about pregnancy? When you want to become pregnant? I know this is one of your big specialties and one of your big interests, right? So what is important if you want to become pregnant, both from the female perspective, but also from the male perspective?
that's a very nice question. Yes, and I know that for this webinar, I think it was a much bigger conversation. That's why we did not include this topic. So I think that we again talking to your physician, making sure that your lupus disease activity, that your disease is as stable as it can be, and making adjustments to your medication. So I know some colleagues of mine that probably have this old-fashioned idea that patients with lupus should not get pregnant, or they have a higher risk of pregnancy adverse outcomes than healthy women. But that's not really the case. I think if you discuss it, if you plan it, there is you can prepare and plan a pregnancy so that you will not have as many risks as you would if you hadn't planned on it. So I think that nowadays what we are seeing is there are a lot of, actually this is something that I'm actually working on, pre-pregnancy and planning for lupus patients and for RMD patients in general. So if we work and if we assess the patient with a gynecologist, with an obstetrician, and if we do evaluations and also adjust their medication, make sure that the disease is stable before getting pregnant, there's really no reason why a lupus patient can't have a normal pregnancy and a normal baby and experience no complications during pregnancy. But then again, I think again it's all about communication and all about multidisciplinary work. But this is the myth. I think that this is another myth that lupus patients can't carry a baby or can't have a normal pregnancy, or automatically they will experience a higher risk. That's certainly not the case. But I think the message is, instead of doing it on your own, and just because I know patients, and this actually breaks my heart, but I've seen patients that they feel that their physician is not open, so they just get pregnant and then they have complications after that. But if we speak about this, and I think in patients, or younger patients, asking them, do you want to be a mother? Do you want to plan a pregnancy? Even if it's not the case, or even if they are not, they shouldn't do that because they had experienced a recent flare. I think talking and planning it and work as a team, there is really no reason why a lupus patient can't have a normal pregnancy. So the important key is just to talk and to discuss it and to plan it.
Yeah. And then I know this is a much bigger topic, so we can talk about it for hours. But I think that's the most important thing, that we communicate about it again. And also, even if you get pregnant without discussing it with your physician, please tell your physician the moment you find out, because they can still do things to improve your journey
Of
towards
course.
motherhood.
And every patient is a different patient.
Yes.
So you can't really say every lupus patient will behave like that. That's not really the case.
No.
So
We are all
trust, I think mutual trust, and yes, and like you said, and talk to your physician, even if you accidentally get pregnant, or you should talk.
Yeah, it can happen.
Of course.
We are all human beings. So, Leah had the very last question in the prepared questions. I think she should also have the benefit of having the last question here. What would you say a patient should do when their sex life is blamed for other symptoms, like nephritis symptoms or regular infections, for a long period of time that a healthy woman wouldn't have? How can we handle this? So, blaming the lupus symptoms, what do we do?
Do you mean blaming it, but by whom? By their partner? By because it
Yeah,
is different, right? What is the I'm not sure who is blaming the or is she blaming herself?
I think Leah means the partner, and from doctors.
From
Okay, so
doctors. I don't think then again, I think that's not a good practice, to be completely honest with you, because I think that patients, first of all, should not be blamed because that's because of their. I think if it's because of their nephritis symptoms or infections, I think to us as physicians, it's our responsibility to work on that and to help control the disease activities of our patients, and also to reduce infection, and ask them and get involved, because maybe there are, of course, all these different factors that they're going to play. But if we're talking about nephritis and infections specifically, there are things that we should be able to do for the patient, and blaming is never an option for me. I think blaming is never an option for anything. But of course, if we're talking depression, if we're talking other factors, of course, there are other ways to assess it and to counsel. But if it's nephritis and infections, I think we should help the patient as much as we can. And blaming is never an option, I think.
no, exactly. Yeah, never feel guilty about what you do and that it might impact your lupus in a negative way. Don't feel guilty about it, because that's
Sure.
definitely not the case. Yeah. So unfortunately, we don't have any time for more questions. It's been very informative, I think for me at least, and I hope it's been for everyone listening. Thank you so much, Christiana, for all the things you told us, and all the materials you prepared for this session.